ASCUS is an acronym that stands for atypical squamous cells of undetermined significance. Squamous cells are the cells that are on the surface of the cervix. So when you get a Pap done, it's mainly looking at those squamous cells to determine whether they're abnormal looking, whether they're dysplastic looking. So that's the whole purpose, or the main purpose of really doing a Pap. So in the case of ASCUS, the cells are atypical, so they're a little bit unusual, but not unusual to the point that they are clearly dysplastic. If they were clearly dysplastic, your Pap would come back with an L-cell or an H-cell. An L-cell is low-grade squamous intraepithelial lesion that normally corresponds to mild dysplasia, and an H-cell is a high-grade squamous intraepithelial lesion, sometimes called a high-grade lesion. Most of the time that's going to correspond to moderate or severe dysplasia. In the case of ASCUS, though, they're looking a little bit off, but again, it's undetermined significance, so we don't know exactly what that means. Now, I'm making this video because it's pretty often that I talk to somebody where maybe they had a history of having dysplasia, so they went in, they had a colposcopic exam done, and the results come back maybe mild dysplasia or maybe even moderate dysplasia. Maybe they had a LEEP done, maybe they didn't do anything. In the case of mild dysplasia, they probably didn't do anything. And then 6 months later, a year later, they do their follow-up Pap, and the follow-up Pap comes back ASCUS, and they think that that means it's gotten better, that there's an improvement. So in other words, they think that in the continuum of abnormality from a completely normal cell to a cancerous cell, that in that whole progression or that whole continuum, that ASCUS is at the very beginning, and then you go into mild dysplasia, moderate dysplasia, severe dysplasia, and finally cancer. So they erroneously think that ASCUS is somehow better than dysplasia, but it's undetermined significance. So literally in the acronym, we don't know what it all means. ASCUS could be just about anything. ASCUS could be normal. So in other words, if you get an ASCUS result on a Pap, it may just simply be wrong. Paps are not perfect. They're screening tools. So ASCUS could literally mean it's completely normal, there's nothing there. So that's one possibility. Second possibility is that it's due to inflammation. Chronic and acute inflammation can cause the cells to look a little bit off, a little bit wonky or atypical. I just did a video about chronic cervicitis. I talk about that a little bit there. So you could have an ASCUS due to just some degree of inflammation, or ASCUS could be mild dysplasia, moderate dysplasia, or even severe dysplasia. So ASCUS could be the full gamut from a normal cell to a severely dysplastic cell. Now, if you have HPV present, so in other words, if the Pap comes back ASCUS and you're HPV positive, normally a colposcopic exam is going to be recommended. So a colposcopy is looking at the cervix under magnification after you put a solution of acetic acid on it, because it'll kind of stain the cell. So then you can kind of see, does it look like anything's actually abnormal? And if it looks like there's an area that's abnormal, you have the option of doing a biopsy. So you can do a biopsy and actually have tissue where you can put that under the microscope and determine, better determine what exactly is there. So ASCUS plus HPV positive, you're probably going to end up doing a colposcopic exam, especially if you have a more, more involved history where maybe you've had dysplasia in the past, maybe you had a LEEP in the past, something like that. Then when you get the result of ASCUS back, especially if there's still HPV present, you don't really know exactly what's there. If you get an ASCUS result on a Pap and you're HPV negative, it makes it very likely that either it's just wrong, that there's actually nothing there and your Pap is actually normal, or maybe that there's some inflammation there causing the Pap to come back ASCUS. In the event of ASCUS and HPV negative, you wouldn't normally have a colposcopic exam at that point. So to summarize, when you get a Pap done, it could come back with 4 different results. It'll either come back negative for intraepithelial lesion, which is normal. It could come back ASCUS, which is there's something looks a little bit off there, but we're not exactly sure what that means. Or it could come back with L-cell, low-grade squamous lesion that normally corresponds to mild dysplasia. Or it could come back as an H-cell, which is a high-grade lesion, which most of the time is going to correspond to moderate or severe dysplasia. So again, if you have a Pap that's come back with ASCUS and HPV positive, and your previous Pap had been, or colposcopic exam or biopsy has been showing some degree of dysplasia, ASCUS doesn't necessarily mean that it's getting better. So don't think that. You really won't know that without doing a colposcopic exam and probably a biopsy. I hope you found this video useful. If you did, hit the like button, and if you want more content such as this, please subscribe to my channel.